We're here at the second day of ACTRIMS in the know with MSME Media. Today we have with us Dr. Ben Segal. And Dr. Segal, could you give us a brief explanation for patients who are living with MS? What is ACTRIMS?
So ACTRIMS is an academic organization composed of professors, both researchers and clinicians from the U.S. and Canada. And our mission is to increase education about MS and also to promote research towards better treatments and to increase our understanding of the disease and ultimately manage patients more successfully.
And this morning we were treated to a session where we learned more about the blood-brain barrier and some new news about that. Could you share with the patients kind of a synopsis of what we learned this morning?
Sure. Well, one of the earliest events in the formation of an MS lesion or plaque is breakdown of the blood-brain barrier. The vessels that feed the brain and spinal cord and the optic nerve become leaky, and that allows inflammatory cells to enter the tissue and cause damage. And some of the drugs we use now are designed to block immune cells from crossing the blood-brain barrier. For example, natalizumab, also known as Tysabri, prevents white blood cells from sticking to the lining of blood vessels, which is an early step before they pass across the blood vessel into the tissue. So today we had 4 excellent talks, which are about cutting-edge research using animal models as well as imaging of patients during lesion formation to better understand on a molecular level and a cellular level exactly how the blood-brain barrier breaks down and what type of interactions occur between the white blood cells and the vessel lining cells that permit their entry. And this could lead to a new generation of treatments that block the inflammation from occurring in the first place, stop relapses, and maybe have less side effects because they may be more selective for the type of immune cells that they're targeting.
We've had so many exciting sessions already, and then of course yesterday we talked about some of the new investigators as well. Now this evening we have a very good program. This is really cutting edge news, and we're keeping it under wraps until after 4 p.m., but we will let you know what we learned from that session. But can you give them a preview? We promise not to let the cat out of the bag until this session this evening, but can you explain to us some of that cutting edge information we're going to get this evening in the session?
So there are 4 talks that were selected from late-breaking abstracts. This is the newest research that is currently being revealed in people's laboratories, hot off the burner. And a lot of the talks have to do with how could we instigate repair in MS. Once damage is done, we need to try to restore lost functions. And how can we do that? How can we stimulate reconstitution of the damaged myelin sheath? So there are a couple of talks that are about that. There's another talk that is about how we could increase safety by decreasing side effects with drugs that we currently use or a drug that we currently use. So we're very excited about this cutting-edge research that's going to be presented.
Well, we really thank you, Dr. Segal, for taking time out of our very busy schedule here at ACTRIMS to speak with the patients. And we will keep you in the know with MSME Media.